Okay, so very quick answers. Has retinitis pigmentosa, takes vitamin A palmate. Does it help decrease progression?
It showed, studies have shown that on the electrical testing of the retina, they've seen slight improvement, but in the studies, patients haven't been able to say they've noticed a change in vision.
Okay, astigmatism, what is it?
It's a type of refractive error. Instead of the eye being shaped like a basketball, it's shaped more like a football.
And sets you up for more retinal problems?
No. It's just a more complex refractive error. It can be corrected with glasses or contact lenses.
How long does cornea need to heal after surgery?
Boy, that really depends on the surgery.
Fuchs dystrophy surgery.
Probably a DSAC.
Yeah, it also depends on what type of surgery, if they actually transplanted the whole cornea or just transplanted that inside layer we were talking about. So
pretty quick if it's the inside?
Yes.
Yeah.
Quicker. Migraine headaches, glasses, prisms, do they, to help, have others benefited from prisms for migraine headaches?
Pretty soft data.
Yeah, it's pretty soft, pretty subjective. Some patients of mine have said yes, others have said it hasn't made any difference at all.
60, extensive workup by optometrist, no problems, plan to get another appointment this year, needing prescription reading glasses. Should I start to see an ophthalmologist instead of an optometrist? Do you have a comment about the difference?
I'll tell you, if it's a refractive problem and the vision can be made better with glasses, you can stop there. If the glasses help and reading glasses help, then that's sufficient.
And they're doing screening things for problems?
Absolutely, absolutely.
So the answer is stick with your optometrist. If you have more problems, go to the ophthalmologist.
That's exactly right.
Rapid City, taking advantage, had laser treatment. What causes CRVO? What is CRVO?
That stands for central retinal vein occlusion. That's when, one of the conditions Dr. Geraets was talking about earlier, where the blood flow to the eye can be disrupted. There's a main vein that drains blood out of the eye, and when that gets occluded, that can cause massive swelling in the retina. It can also cause ancillary branches to rupture and cause bleeding into the eye.
Big time problem.
It can be, although we do use a lot of those injections with the anti-VEGF medications, and in some patients we can get a lot of that swelling to settle down and actually control it to a certain extent.
If this particular patient has had laser, though, generally that means that the vein occlusion is a very, very severe type. It's one of the most difficult problems to manage because once you require laser treatment, the chances of meaningful vision being recovered are very, very, very low.
Can eye-related blood pressure problems, for example, glaucoma, be indicated of underlying pulmonary disease? Pulmonary disease. I don't
believe so.
I generally think sleep apnea. That's kind of some weak associations for retinal conditions, but generally separate.
Okay. Love the show. Do it again. How about that?
Happy to.
Macular degeneration, YAG procedure, photodensity procedure.
Photodisruption.
Photodisruption. Yeah, basically what that is after you've had cataract surgery and that implant is in your eye, a haze or film can start to form on the back of that implant over time. If that gets bad enough, it can start to affect the vision. There's a laser procedure that they can do to remove that, and that's what they call photodisruption of that, and you can absolutely have that done. That'll have no impact on the macular degeneration.
Okay. Night blindness.
Retinitis pigmentosa is the first thing that we think of. There are some other rarer conditions as well, but it should be looked at and worked up.
20 to 30 years, watering a lot, can't cry now. I have no good answer.
I don't know if I have an answer for that one.
Yeah. Floaters in the eye, 3 shots in the eye, then went blind. What was the diagnosis?
3 shots. Likely a vein occlusion.
I was going to say it's probably a vascular event of some type.
Sometimes with a vein occlusion you get spots of blood, and the patients will see the shadows of those spots of blood. We'll use injections sometimes to try to treat swelling. Sometimes about 30% of those vein occlusions can change over to the really severe kind we talked about earlier, and the vision can be lost despite the shots.
Somebody noted a lump under my chin. It's just a fat pad I inherited from my father. Thank you, Earl. Corneal emotion with dry eyes. Corneal erosion with dry eyes. Had surgery to fix. Has macular degeneration as well. Corneal.
Separate problems.
Yep.
Pressure vision for macular degeneration, something better. can I take then the
Oh,
Preservision.
Preservision. That's to let your viewers know, that's a name of one of the brands of vitamins. What we talked about, I don't really care what brand you take as long as it's that AREDS 2 formula that's in the bottle.
But Preservision, and actually a lot of the research that was done with the people who, the Bausch and Lomb people were selling the vitamin supplement, that's Preservision.
Yeah, Preservision's the name brand of the Bausch and Lomb
Yeah,
brand.
as long as it says AREDS, AREDS 2.
AREDS 2, that's what matters.
Correct.
Yeah.
Air blew into the eye wearing a mask and causes problems. Oxygen air blew into the mask.
Oh, sounds like CPAP.
Yeah.
Could be.
Yeah. Or
Dry eye.
Dry eye,
probably,
Dry
probably,
eyes,
yep.
yep.
Cataract lens put in, then I don't know what that is. Migraine in optic. What causes that? Does it come back? Migraine in optic nerve?
They're probably talking about ophthalmic migraines again, where you can have basically kind of a spasm of a blood vessel that can cause some irregular vision, and sometimes it can even go totally black. Usually resolves on its own over time.
What's the best eye drop for dry eyes?
I usually look at Refresh, Systane, or Genteel. Those are name brands, but the preservatives in those particular tiers are very, very gentle.
It's pretty subjective. Some patients, a lot of it's trial and error. You just have to get a couple of small bottles and try them and see which one works best.
Is there a
for you.
generic?
There is, but the preservative tends to be a little more irritating in those.
Okay. Husband, one eye wet, one eye dry, telescope procedure.
Yeah, basically what they're talking about there is the macular degeneration. He obviously has one eye that has the dry degeneration, one eye has the wet. There is actually an implantable telescope that can be put into the eye. Now, if you've had cataract surgery already, you can't have that procedure done. That's basically what that is doing is giving you high magnification in that eye.
So it matches the other eye?
Well, no, it just magnifies vision. It's like having a built-in telescope in your eye, but you got to remember what happens when you look through a magnifying glass.
You think you're closer.
You have no peripheral vision. Also, and people with macular degeneration are very dependent on their peripheral vision. So.
Thank you very much, both of you.
Absolutely, anytime.
Willingness to answer these questions, and boy, thank you for the questions.